Welcome to the BioWhisperer channel. Our topic today is on a perspective overview of immune sciences. We will focus on COVID-19 immunobiology. So how does COVID-19 vaccines work? What is vaccination? It refers to the act of introducing a vaccine into the body to produce protection from a specific disease. Immunization is referred to the process by which a person becomes protected against a disease through vaccination. This term is often used interchangeably with vaccination or inoculation. Immunizations are an extremely effective way of preventing disease and death among children and adults around the world. Immunizations are extremely cost-effective compared with the cost of combating the disease once contracted. Given the urgency and persistency of COVID-19, the World Health Organization supported initiatives including the expanded program on immunization and the Global Alliance for Vaccines and Immunization, as well as funding from charitable organizations and governments. Immunization rates are rising around the world. Vaccination is the safest way to protect against an infectious disease. Once you have been vaccinated, you should have the ability to fight off the infection if you come into contact with it. How does vaccines work? Vaccination is the safest way to gain immunity against a pathogen that your body has yet to encounter. Vaccines activates and in turn train your immune system using a harmless form of the virus. Since vaccines contain a harmless form of the bacteria or virus that causes the disease you are being immunized against, your immune system will still recognize the harmless form of the bacteria or virus in the vaccine without making you sick and will produce a specific immune response to fight it off. Two key sets of cells, B and T cells, are activated and these cells remember the virus and remain in the body. This is termed as immune memory. The first group of cell is called the plasma B cells that make highly specific antibodies to stop the virus getting into your cells. The other group refers to the T cells that can help stimulate the B cells and kill any infected cells. The immune system then maintains a memory of the bacteria or virus, so if a vaccinated person encounters the bacteria or virus later, their immune system is already prepared to fight it off quickly and prevent an infection from developing. Having the vaccine train your immune cells meant that if you encounter the real virus in future, your immune system responds faster and more effectively to prevent infection. I would thank you for helping to share your love for this science channel by clicking the like button and subscribe for future updates. Myself and my team of fellow retired educators, Dr. BioTech Whisperer's team of 4 curators including Dr. Owl, will love to hear your comments and suggestions for future topics. With that out of the way, let's continue the discussion. Pathogens are described as disease-causing agents which includes bacteria or viruses. Your immune system recognizes unique features of the pathogen, called antigens, which will trigger an immune response. Our immune system recognizes unique features of the pathogen, called antigens, which will trigger an immune response. One of such response is the production of antibodies by a set of cells called plasma B cells which act as scouts, hunting down the pathogen, sticking to its antigens and marking it for destruction by the immune system. Antibodies recognize antigens and form complex which in turn is referred to as a process called opsonization. One important aspect to note is that each antibody is specific to the pathogen that it has detected, where the matching against the shape of the antigen is highly precise and triggering a specific immune response. Apart from the B cell response, which produces antibody, the other response involves activating the specialized immune cells called T cells, which can attack and kill any cells that are infected with the pathogen. After clearing the infection by the pathogen, these specific B cells and their antibodies and T cells will remain in the body after the infection has gone as memory cells. The memory effect meant that patients will have a level of protection, or immunity, against the disease upon next exposure. Active immunity results when exposure to a disease organism triggers the immune system to produce antibodies to that disease. Active immunity can be acquired through natural immunity or vaccine-induced immunity. Firstly, natural immunity is acquired from exposure to the disease organism through infection with the actual disease. The other way is through vaccine-induced immunity is acquired through the introduction of a killed or weakened form of the disease organism through vaccination. Active immunity is long-lasting and sometimes lifelong. Passive immunity is provided when a person is given antibodies to a disease rather than producing them through his or her own immune system. An example of passive immunization is when the newborn baby acquires passive immunity from its mother through breast milk. The more common method of gaining passive immunity is through antibody-containing blood products such as immune globulin, which may be given when immediate protection from a specific disease is needed. During early days of COVID-19, medical doctors are trying to isolate neutralizing antibodies from recovered patients, including culturing the B cells to produce a COVID-19 antibody cocktail as a therapy. The major advantage to passive immunity is that protection is immediate, whereas active immunity takes time, usually several weeks, to develop. Something we have to note is that passive immunity lasts only for a few weeks or months. On the other hand, active immunity is long-lasting. What is COVID-19? The World Health Organization declared it a pandemic due to the severe acute respiratory impacts triggered by the causative virus, which is called SARS-CoV-2. The virus is from the coronavirus family. The disease caused by SARS-CoV-2, COVID-19, can affect multiple organs across the body and is not limited to only the lungs and respiratory system. Symptoms vary across patients, and is largely due to the infective strain involved. For instance, the Delta strain is known to be highly transmissible with milder symptoms. As of end 2021, the Omicron strain is reported currently to be highly transmissible even against fully vaccinated individuals. Some people can also suffer long-term effects from COVID-19 and take many months to feel well again. This is called long COVID. Scientists and doctors are still understanding the long-term health consequences of COVID-19 that may be serious for a long time. Long COVID is henceforth determined as COVID symptoms continuing for more than 12 weeks after an infection, which can be either severe or mild, but which can't be explained by another cause. Researchers have put up some suggestions. One possibility is the infection makes some people's immune systems go into overdrive, attacking not just the virus but their own tissues. That can happen in people who have very strong immune responses. The detection of the virus within our cells and tissues might explain some symptoms like brain fog and a loss of smell and taste, while damage to blood vessels in particular could lead to heart, lung, and brain problems. The only way to get COVID-19 naturally would be through infection with the SARS-CoV-2 virus that causes the disease. Vaccination allows you to build up immunity in a safe and controlled way without becoming ill with COVID-19 and passing it to others. Post-COVID recovery, patients would have an immunological memory, similar to that triggered by vaccination. The levels of neutralizing antibodies within the patient or individual will be important to protect against getting COVID-19. That being said, vaccines are capable of stimulating a better immune response than the natural infection. It is hoped that vaccines for COVID-19 will provide protective immunity for at least as long as natural immunity. Current and ongoing research and clinical trial data support the fact that vaccine will induce more effective and longer-lasting immunity than that induced by natural infection. Hence it is recommended that everyone can take the vaccine to boost the body's immunity against COVID-19. Thank you for watching this video. If you like this video, please smash the like button and subscribe to this channel for future updates.